We've been so blessed to have such brilliance, such great people as part of our family to help us keep educating dentistry. This pandemic is not close to being over, I don't think, but we're getting through. And dentistry's big win with being considered essential, not being shut down for the second time, and also dentists being on the top of the list for vaccinations as of this week. So we're really excited. IPAC, I can tell you probably Susan and Sonia have a deeper passion in their heart for IPAC than maybe I do. But I love smarter people than me, and I love people that have a passion about things that they can we put into place from the not only just IPAC, but also the automation of how to, to multiply our efficiency in dentistry right now. We've got to really simplify and automate as much as possible. So I look forward to hearing all the brilliance of you. And I also, Dr. Jordan Soll has been a member of Transitions Family for decades. I think he remembered me when I was pregnant with my third born, drinking milk at his kitchen table, as he reminded me when she turned 16 last week. But Dr. Soll's always been an innovator. We connect because we're such big vision, long-term visionaries. He's been an early adopter, open to change, and probably the most inquisitive dentist probably I've ever worked with or had the privilege to be friends with. And Jordan's practice is, it's all class, it's charm, it's state of the art. We talk about the challenges with the expectations of his patient base and how they raise the bar every time they come in for a visit. And Jordan's team, their morale, their culture, and I have been personally on site to see Jordan's infection control reprocessing with the use of SterilWize, and it's second to none. So Jordan, could you share from an experience of a wet-fingered dentist, solo practitioner, you're still here, you're thriving with regardless of the pandemic, but could you talk about just your experience with as an owner and as a dentist, what pressures and different things that IPAC brings up and how you adapted to that?
Thank you very much. Good evening, everybody. Thank you for that great introduction, Lisa. I'm going to start off, just take a few moments. I'm going to start off, tell a little story from when I was very, very young, and you're going to wonder, like, what does this have to do with IPAC? But the story that I'm going to tell you is that when I was a really little boy, and I had a very smart, very witty mother who was also very strict. And when I was a little boy, if I did something wrong, I'd get the tar beat out of me. And I'd be crying, and I'd say, well, little Johnny down the street, he did the same thing. And I'd get walloped again. And my mother would say, I don't care about little Johnny down the street. I only care what goes on in this house. And I've always taken that lesson with me in life. And when COVID hit, and I would think it's safe to say probably for the first 2 weeks when we were shut down, we were all paralyzed, just deer in the headlights. We were just so paralyzed. And then I just, okay, like when the going gets tough, the tough get going. And I rolled up my sleeves and started to think, okay, we're going to come out of this. I saw some great seminars that dentistry is going to be needed. We are going to be coming out of this. And what are we going to do? And I started thinking about, I started to see Zoom lectures and stuff. And the key word for running my practice, and I think everyone started to think about, is digitization. Everything has to be digital in what we do. We made specific changes. We took out our consultation room. We put in a 6th operatory so that we could work with the fallow times. And we just started to really think about what was going on. Susan McGuire, who teaches you how to set up your processes, run your processes in your office, and she'll talk to you further about that. She'll can tell you that how important it is to make sure, it's never been more important than it is today, to make sure every one of your reprocessing systems, how you're going to get your instruments from the patient's mouth back into a new patient's mouth, how the entire process is going to work. Sonia's going to talk to us about all the things that, God forbid, a snap inspection happened. How would we survive it? So I'm going to sort of fill in the blanks as we go along. I'm going to talk to you about how the ideal that Susan's going to talk about, that Sonia's going to talk about, how I actually use it in my office. It's not to say that I'm the gold standard, but I will tell you at 64 years old, I've never been more confident about going forward. I plan on working another 10, 11 years, and how important it is that you must stay on top of all of the regulations that our college and that the Ministry of Health is throwing at us, because it just takes one complaint from a patient to become a career ender. So the information you're going to get tonight, I think, is going to help you really um, turn this into a marketing strategy where your patients are going to be out talking about how clean, how neat, how safe they feel in your practice. It's not, wow, I had that great veneer done. It's now people are talking about, wow, I just came out of my dental office. I feel so safe. I felt so secure. I felt they took every precaution possible. I don't mind referring people there. I don't mind going back for my next visit. So saying that, I'm going to turn it over to Sonia, and I'll ask Sonia to sort of jump in and start talking about why we're paying more attention to IPAC than ever before.
Awesome. Well, Jordan, you made some really, really great points there about making patients feel safe. I'm so happy to be here to speak to everyone about IPAC. I know it's a fun topic. Hopefully, you're not all rolling your eyes at that. I'm sure Lisa is somewhere rolling her eyes over there at the mention of IPAC being fun.
There's no eye
But
rolling happening here, son.
but all kidding aside, I know for most of you, it is an overwhelming topic on a regular day. And that was before COVID. And now with COVID, it's becoming even more frustrating, even more confusing, and it is just constantly changing. But for me, I've always had a love of all things healthcare, anything science related. So the opportunity to be here to help all of you with your IPAC needs, it really excites me. I love using my science background, my experience as a hygienist, and I really hope that what I do, I can give you some good, valuable input. So by saying that, we will figure out why we're here today. We're talking about why we pay more attention now to IPAC. Um, for most people in Ontario, and I'm going to be speaking mostly about Ontario because that's most of our viewership right now. We know that IPAC actually changed back in 2017, 2018. There were huge, huge changes due to a hepatitis outbreak that was in southwestern Ontario. And it was traced back by public health to dental offices and I believe an ortho office as well. And a lot of the offices still hadn't caught up to these changes and then found ourselves in this pandemic. So if you weren't up to date with all of your processes and your renovations to your sterilization centers, this became so overwhelming for you and so time consuming. And that's why Transitions is here to help you, especially when it comes to your manual. I can pretty much guarantee if your manual is not 60 to 100 pages long, it's not thorough, it's not detailed enough, and we want to do our part to help you. And I think we can all agree, like what Lisa said, dentistry is amazing. You can go into doctors' offices and hospitals and not see anywhere as good of standards as dentistry has, but it's about your IPAC manual too and what you're writing down. And we love providing these services for you, and it's an investment, but it takes away the effort and the grief in the long run. Um, so, with that being said, we'll get into what COVID has changed for us. Okay, there's some very obvious things that have changed and some not so obvious things that have changed. COVID has made the whole profession a little bit riskier. Okay, we're doing AGP, aerosol generating procedures, which no one's really doing outside of hospitals when they're intubating patients. So, it scares people, it scares our staff. We want to make sure we're protected. And then everybody knows COVID has made everything more expensive. Okay, there's PPE costs, there is the downtime because of fallow time. Hygienists are not able to Cavitron now. We're having to hand scale, and the appointments are longer. Having to restructure, renovate, put up barriers, get your HVAC in order, all of these environmental requirements. In the beginning, there was a lot of limiting treatment to emergencies only. And a huge thing that a lot of people underestimate is the losing the momentum in your perio programs. If you had your patients on 3-month recalls and they've missed, they're now, not wanting to come in. They're not wanting to risk their health to expose themselves. They're not seeing the value. So all of those things are pretty obvious. What's not so obvious, which we're going to speak to a little bit more today in our webinar, is that COVID has made it a lot more likely that public health is going to come in to do an inspection. If you have even one incidence amongst your patients, amongst your staff, it constitutes as an outbreak. And they're going to contact trace back to your office. And if you don't meet their needs at that point, they're going to come in, they're going to assess all your processes. And so we do not want that, especially if you haven't caught up. So I like to get into a little bit about how public health works. I've been lucky enough to work with a couple of inspectors in different municipalities. And, there's a lot of fear amongst dentists if they don't know exactly how it works. So one thing we can say is that inspections are not randomly picked. They are most likely based on complaints and incidents of transmission of illness and injury. And illness, COVID is one of those things. But we'll talk about complaints a little bit. Complaints are coming from two sources. We find complaints from the patients and the public, which is the people who are bringing the patients in, like parents and that kind of thing. And those are much more likely now, we're finding, because everybody is watching. And I always say this to our clients, it's almost like you have to put on a show. When I went to the doctor, I've been going to the same doctor for a long time. And I always like to tell the story about one day I went in and she got her hand sanitizer from the dispenser. And she literally came up to me and she's like, "Hi, Sonia, how are you?" As she was doing her hand rub. And all that went through in my head was, she must have had some sort of complaint about hand hygiene, that now she's making it very, very evident that she's doing it right in front of my face. And I find that this is something that you need to almost do. You have to put on what I call the show, so that people who are watching know that you're doing what you're supposed to be doing, because sometimes it can be very subtle things, especially when you have an open concept sterilization area, when you have an open concept office, like a lot of ortho offices. You want to be careful, everything you're touching, your hand hygiene, taking appliances out of lab boxes, all of that. The other thing is that everybody is informed. They're researching, they're Googling, they're seeing what other offices are doing. So they may be attending, different specialties and seeing, well, that specialty had a barrier on their mouth and you guys don't. So I've had that brought to my attention many, many times while I was in practice. And there's a very small percentage of people who will actually bring it up to you. They're more likely to be upset about something and not say anything and go and complain. Only a very small percentage will bring it to your attention. So you have to be very, very aware of that. And the other thing is people are rightfully concerned right now. This is a life-threatening illness. They're taking it very, very seriously, much more seriously than they would have before. And they want to trust you. And like what Jordan had said, if they trust you, they're more likely to come back. And then there's one more source of complaints, which is very, very unfortunate. It's because it's from your staff. So I find that between hygienists and the dentists, the colleges weren't aligned. And fortunately, in the last little while, they've become much more aligned. But before, there were some concerns about hygienists losing their licenses if dentists were not complying, or dentists having to comply with more stricter protocols that weren't necessarily in public health guidelines. So now things are aligned, but you just want to be careful. I like to advise everybody just kind of go with the stricter of the guidelines if it's possible. And we also have to be aware with all of these complaints that if public health comes in because of an issue with illness and they do find a lapse in your protocols, they can then report you to your college. So if it's a hygienist, they can report to the CDHO or the governing body for the hygienist, and likewise with the dentist. If they find any safety violations, they can also report you to the Ministry of Labor. So we really want to avoid public health coming in. So, and a little bit more about actual the categories that public health uses. So there are so many categories, and you'll find that public health officers have, they're all different. So they have different criteria that they have to follow. So one public health inspector may choose to view something as more serious than another. There's no consistency. It's unbelievable how their processes differ. So you just want to make sure you're on top of it. There are 98 criteria under core elements. There are 69 reprocessing, and they all have different risk assessments. So depending on what you're violating, you could be violating just one of them, but it could be a high risk violation, and that could cause you to get a shutdown if you don't correct it immediately. With COVID, there's about 23 criteria. There's no real checklist. But when I do my on-site mock audits, I include all of these criteria, as well as a few from the colleges and the Ministry of Labor. So having said that, we are going to discuss some of the areas, and there's 10 of them, but there's definitely more than 10 that I find, but this is a great starting point for today. It's a top 10 countdown of the key questions that dental offices should be focusing on when they're concerned about an audit. Okay, what pitfalls we're avoiding, where we think that we're complying, but we're actually not. There's a few things missing. There's a few misconceptions. And I always like to say, when it comes to your IPAC manuals, we all learned this in school. If it is, you may be doing it in your office, but if it is not written down, it's like it doesn't happen or didn't happen. Okay, so public health will take into consideration if they come in, they know you're nervous, you may miss a step in something that they're assessing, but if you can show them that you have this in your IPAC manual and this is what you're training your staff on, they're going to give you a little bit of leeway. And that's a really, really important point. So always make sure that you have these processes written down in your IPAC manual. So we'll start with number 10. Okay, it doesn't mean it's the least important, but it's number 10 for tonight. It is, are all of your hazardous materials labeled and referenced appropriately? So I have never seen a practice that has an up-to-date SDS binder. I've seen SDS boxes with things thrown in. I've seen binders with things loosely just thrown in and they're not organized. You need to have a system to organize it. I recommend it being alphabetical, but some people have them as categories. Whatever it is, your staff needs to be able to find the information in an emergency. And I will say this, there was a client that had a toddler in the waiting room who drank the hand sanitizer, which was recently mandated in that 2018 change to be out in the waiting room. And the mother had been in the back with the older child getting an update. So this toddler was outside coloring and there was a whole kerfuffle. The mother was called, the reception called poison control. It all kind of snowballed into public health calling and doing an investigation. And they got dinged on not having a label on their hand sanitizer. And everybody was shocked about this, but most people know that I have hand sanitizer right here. There's no toxic labels. There's no handling protocols on here. This needs to have an SDS label on it. Um, it would then have led the receptionist or the mother um, to be able to access this emergency information and what to do. So these are kind of the examples that kind of show you that you need to have labels on anything that has a handling precaution with the name and the reference to the binder. And this is where I find a lot of people are lacking. So hopefully that helps you. And we'll get into number 9, which is do you have a sharps safety policy with a management of injury protocol? So again, a lot of offices are doing a great job with having a sharps policy. They have their sharps containers, they're in the right spots. But what is missing is, are you transporting your instruments from the operatories to the reprocessing areas in a covered container? And a lot of times you are doing that, but it's not written down in your IPAC manual. Okay, so that's what we need. And then do you have an actual plan if somebody does get injured? Okay, who is it reported to? Who keeps a record? Who follows up? Do you have an actual incident form that is filled out saying what happened and how it was handled? So these are the things that are missing when it comes to management of injuries in the SHARP safety policy. And then we'll get into number 8, which is, do you have a dental unit waterline maintenance and testing protocol? So again, most practices are doing a great job. They're treating their water lines. They're doing it at the right intervals. They're logging it, but they're not actually testing the water. Okay, they're not logging that either. And actually, public health knows that this is one of the things that most offices are not doing. And it's one of the things that they know they'll ding you on. So they'll ask that first. So, and of all of the things that I find clients find this the most frustrating because they don't know where to start. They don't know what products to purchase. They don't know what's right for their offices. They're reaching out to their manufacturers of their dental units, and the manufacturers are not sure about what products. They were not told. They're not up on their standards. So they have
Sonia,
to. Yes,
can I jump in here?
of course.
So from a wet-fingered dentist or practicality point of view,
Yeah.
this is where I recommend, or what I have found over the years. I work with one of the large dental companies in Toronto or nationally.
Mhm.
I have an excellent dental rep that I also can lean on, because for you to become successful, you're going to have to delegate. There's no other way. And from when I started my practice, I had my finger on the pulse of everything. If you're going to become successful, you're going to have to put top people in around you, and really delegate. And my office manager coordinates with my dental rep. And what we do is each of our 6 operatories has a separate pre-printed sheet, and we test our water lines every 3 months.
Mhm.
So whether it passes or if it doesn't pass, we test our lines every 3 months, and and if the water lines or if the water tests come back negative, we shock the lines and then retest again until they come back positive. So we wait to see if the water lines fail or not, and then we'll continue to test until they do pass. And then that is recorded in our sheet. So if public health comes in, take them into every operatory, and we show them the sheet every 3 months, like clockwork, the test, and that it passed. If it didn't pass, that we reshocked again until it does pass. So these are the sort of things, and you can rely on your dental rep to help you set up the proper sheets and what you need and how you test.
Yeah, exactly. And all of this is done as per the manufacturer's instructions for you. So that's where having a great dental rep who knows their stuff really comes in handy. And unfortunately, they're not all good. So I'm sure you'll get people asking who yours is. But and that's what I was going to say with the water testing. It gets a little bit easier once your water sources pass after a few times. You're starting to do it every 3 months. It's not as time consuming and as expensive, but it is, if you haven't been doing it in the beginning, it can be a little frustrating. And I would say that's probably one of the most frustrating things for our clients. But I'm glad that you've had a great experience with that. And then number 7, do you have an environmental cleaning policy? So most offices have this completely missing. They're doing their cleaning, they're doing sterilization, disinfecting, of high touch surfaces, but it's not written anywhere in their policy. So you have to distinguish between high touch and other surfaces that are not cleaned every day. And you may have, this contracted out to cleaners. It has to be kind of explained in your IPAC manual. So a lot of people are missing that completely. And then number 6, do you address blood and bodily fluid spills? This is so much fun in your waste management policy. You can have it as a separate policy, but it kind of all goes together. A lot of people are missing this component and they don't have an official policy in place, and they don't even know what you're supposed to say. So bodily fluid, other than blood, includes urine, vomit, saliva, all those fun things. What are the steps involved in cleaning it up? What PPE are you wearing for it? And where are you disposing it? All of this has to be outlined in your manual. Then we get to number 5. Are you labeling and logging your sterilized instruments properly? So this is a huge one. You're going to be hearing a lot about it later on tonight. I won't get into what exactly is supposed to be on the label. There are some provincial differences here too. Making sure that you have a contents label as well as the sterilizer label is important. And also, I always advise, it's not mandated, but if there is an intricate way that you're arranging your cassettes or disassembling your hand pieces, it's really useful to have photos of these in your manual, because a photo is worth 1,000 words. So it's a lot easier to just have a photo. The other thing with labeling is that it's very, very important that you're logging this in the patient's charts, which we're going to get into why a little bit later. And number 4, are we wearing and using PPE properly? So most people are wearing all the right PPE. And when it comes to COVID, I cannot stress enough that this is exactly what they're wanting you to track. And this is exactly what the first thing they're going to be checking. So it's very important that you're writing your PPE used on every patient in their chart. You can have a legend, so you use a code, so it's not, you're not writing tons of information. But we know we're doing this 20 times a day, donning and doffing. But the question is, are we doing it right? Are we doing it in the right order? And are we doing it in the right location? Are we doing it in the op? Are we doing it outside of the op? I'm also seeing a lot of patients not using their N95s correctly. They are taking them off, putting them back on, which is allowed in shortages, but I'm seeing excessive use, like people wearing the same N95 for 2 weeks. I'm also seeing people covering them with a level 3. These are all no-nos. You want to be using a face shield instead of a mask. And when it comes to gowns, I'm finding people are using, if they're using reusable gowns, they're using them all day. They are taking them home to launder them. There are, dentists who are taking all of the gowns home and laundering them. This is actually probably a huge mistake because, well, it's not allowed. But if public health comes in and you have reusable gowns and you don't have the other things in place that need to go with the reusable gowns, i.e. the bins that you would normally be disposing them of, or a contract with a laundering company or on-site laundering facilities, it's not something that you can fake the day of or the day after, so you want to make sure if you're using reusable gowns, you're doing them properly and you have all of these other systems in place.
Sonia, I want to add to
Sure.
all the participants that everything that Sonia and Susan are going to talk about, if there is ever an area that you do not want to skimp in, the IPAC is the area. Do not skimp in it. If it means you're going to make a little less, this year until you really get running smooth, you want to make sure that you have all your suppliers, gown suppliers, know exactly what you're doing, because you're only going to get one chance to make a good first impression.
For sure. And this is not one of them that you can fake. The other thing is, in your reprocessing area, you want to make sure whoever's doing the reprocessing is wearing the proper PPE, full PPE. A lot of offices are doffing their gown and putting it back on when they return to the reprocessing area. It has to be a new one each time. You need to be using heavy duty gloves for protection from sharps and from chemicals. So a lot of people are missing out on these little components. And then we get into are using the right protocols for aerosol generating procedures and non-aerosol generating procedures. I won't get into the standards. This is something that is talked to death. But again, when it comes to IPAC, I find depending on what is happening in the community, the colleges and public health tends to change what is required. And they say, well, when the community incidence is low and when it's not low, well, there's no numbers that they're associating with it. And it's very unfortunate that they don't have like percentages that we can go by. So I always recommend just go by the stricter of the protocols. Keep going by that, because even if the incidence is low in the community, again, you get one incident in your office and public health is coming in. Okay. The other thing I find people are missing out on is their HVAC report. A lot of people think they have an HVAC report, but it is actually an email from the company that put in their system, or it's an estimate, or it's an invoice. That is not good enough as an HVAC report. You need to have, doesn't need to be in your manual, but needs to be accessible. And that brings us to number 2. Does your reprocessing area meet all the IPAC standards? So a lot of offices have great reprocessing areas. The one thing I find is lacking, or 2 things I should say, is that there's no, a lot of times there's no clear distinguishable division between dirty and clean. It just kind of flows. You need to have a barrier, you need to have a wall, you need to have some sort of marking that can show you that there's no splashes going over from dirty to clean. I also find some of the older offices, if they have one entrance to the reprocessing area, you need to have a clear direction, a flow, arrows, signage, whatever it may be, to show that people are going in and following this direction. A lot of places are not storing things correctly. In the sterilization area, we all know dental offices, sometimes they can be small, there's not a lot of storage. If it's above or below the dirty section of your sterilization, you cannot have items that are going in for patients. You can't have your impression material, you can't have your impression trays above any dirty area or below. You can't have anything under sinks, anything where a clean item can become wet. Okay, and that goes for your operatories as well. So you have to be really careful how you're storing things. A lot of people are not packaging their instruments in the open position or disassembling their hand pieces if they're multiple pieces. And they are using single-use items more than once. Okay, and one of the offices that I mentioned in that hepatitis outbreaks, they got dinged for actually their donuts, their ligature ties, which say single use only. But what was happening is the practitioner was using a donut, and then the rest of the string that was left was being sterilized or cold soaked, and they viewed that as reusing a single-use item, and that was unfortunately what they got written up for. A lot of offices, I find impression trays, they have a problem with those plastic ones. They're using them, they're single use, but they're using them more than once. So you have to make sure you're going by your MIFU for every single thing, even things, small things like your cleaning brush in your sterilization area, what you're using to brush your instruments. That has a MIFU. It has to be disinfected. It has to be cleaned. It has to be stored in certain ways, and you have to go by those MIFU. And public health knows these little things to look for. So you have to be very, very careful with that. And we are at number 1, which is the most important. Other than PPE right now, this is the most important thing. Do you have an effective failed biological indicator policy and patient tracking method? So people are doing a great job testing. They're using their BIs. What I find they're struggling with is tracking methods, linking the instruments back to the patients. Sometimes there are so many packages that are opened, typing, writing, transferring all this label information into the patient chart is so time consuming. Time is so tight right now. So trying to write all of that information down, if you have paper charts, trying to find space for all of that, it's a full-time job. It generates a lot of paper, and it takes up so much time. And when I was practicing, I didn't realize there were technologies like the one that we're going to hear about tonight. It saves time, it saves money, it saves a lot of sanity, I'm sure. So with that, I'm very happy to introduce Susan. She's going to be speaking to us about a technology called SterilWize and how it's changed the game for dental offices. And Susan, I will leave the floor to you. I think, Susan, you're muted.
Sorry about that. I was just praising you, Sonia. Thank you. That was yeah, that was very informative. A great overview. So what I will talk about now for you, and I do know a lot about IPAC also, is the SterilWize system. It's a scanning system, an automated scanning system for your sterilization area. And let me just, whoopsie, what happened to my screen? Sorry, let me share it again. I feel like I got cut out of sharing my screen.
Hey Susan, it's Gavin here. I can see your screen.
But I cannot.
Oh, it's on the first slide again.
I'm seeing Sonia's screen.
Oh my, Gavin, I see Sonia's screen.
Let me stop share and start again.
Sure, no problem. Everyone has access to share their screen.
Okay, so now it's when I was doing the slideshow.
You're good, Susan.
It's, yeah, okay, so I just can't put it into slideshow. That's fine. So let me go back, share my screen again. Sorry, guys.
I think it was just going to the first slide. And
Yeah, you're going to the first slide. If you advance to the start of the SterilWize deck, when you click.
Oh yes, you know what? That's so funny. That's so silly of me.
you can probably just
yeah, sorry. I did from beginning instead of it's late. I did from current slide. Bear with me, guys. Everyone just drink your coffee, or well, who's having coffee this late?
So after the first slide comes up, you could just use the arrows to go down to the slide that you want. Even after you go full screen, you can.
Okay. Oh, okay. So okay. Got it.
Yeah, just advance down to where you want.
There. Okay. Good. Good. Sorry about that. So yes, let's talk about SterilWize and what it can do for your practice. It was great having Sonia go first because SterilWize takes care of almost all of the 10 points that she mentioned for IPAC. This is just a nice little view of SterilWize in the office. Right here, the clinical staff member, and let's not talk about that she doesn't have glasses on. This is just a picture, but right where she is right now, she is scanning her instruments in. They're going into the sterilizer, and then she would be scanning them out here. And then also you do scan them out in the room. So that's just a quick little visual for you to see how compact it is for sitting in your sterilization area, and takes away all of your paper. So there's no pen to paper going on at all. SterilWize takes care of all of it. So it's a workflow management system. It oversees your reprocessing from the minute you package your instruments, put them into your sterilizer, and it goes all the way to using them on your patient. So it assures that all required processes are followed. It's a workflow management system. And what that means is that you cannot miss a step. So there's no human error there at all. It's if you don't do your biological indicator test for your first cycle of the day, you can't use that sterilizer until it's done. Same with if your sterilizer needs a Bowie Dick air removal test. You can't use that sterilizer until you've done that step. So it takes away the stress of forgetting to do something. You're so busy. Of course, no one would purposely skip a step, but you could accidentally forget to do something. So it takes away all of that. We'll talk about documentation and the reports that you get. This little tablet here has a scanner on the bottom, so you're just scanning your items through. I have a larger view of your dashboard. So this is called your tablet dashboard. It mimics exactly what you would have in your office. So this office has three, these look like mid-marks, but don't quote me, three of these sterilizers. If you had another type, let's say you had a Alexa or a StatClave, that picture would be there. And if you had one that needed a air removal test, it would have the icon there. So it's all programmed for what you have so that you complete all the steps that you need. There's a handpiece lubricator. This office has an ultrasonic. It also has a small instrument washer. This is the type of incubator that it has. On the right side is the start of the day. So if you click on that icon, we have start of the day and end of the day. It opens up and gives you the processes that you've told SterilWize that you need to do at the beginning of the day. Turn on the compressors, turn on your computers, maybe wipe down the chamber. That might be something, one of your manufacturer's instructions is that every day you should wipe the inside of the chamber of your sterilizer, so that now you've done all of those, completed them, checked off that yes, they've been done, and now they're saved, that those instructions have been completed daily. These little icons right here, these are little information and maintenance icons. So to talk about the point of maintenance, let's say waterline testing, that's something that you could put into the sink area just because it's water. It's a maintenance you would put, and one of these icons would have an M on it. And you could click it and it would say, do your waterline testing every 3 months. So what it means is that would pop up for you in 3 months, and it would say, time to do your water quality test that you have to do. Not that you have to do it the second it pops up, but now you've been reminded that this is something you have to do. You'll go and do it, and then you'll check off that it's been done. So now instead of having little maintenance records that you have to keep, this is going to be in your system already. Same with your sterilizer. If every month you have to empty your water chamber, the water chambers, and refill them or clean them, run a cleaner through them, is going to pop up for you so that you know that that's what you have to do. And you won't forget to do it. Your ultrasonic, it would come up, you would program in here to do your ultrasonic foil test once a week. So maybe you want to do it every Monday, it would pop up and remind you on a Monday. On the left side of this tablet, this has all your reports that are here. your team who has wristbands for this, your labels, any settings that you need on here, all your load reports. So if you want to quickly take a look at a load report, you can open it up. Let's say public health, who we know, they come in to do the inspections. I just wanted to add that they're the good guys. They're actually protecting the public. So they're coming in and they just want to know you're doing everything correctly. So you could easily just pull up your load report here for them to see. I'll show you in another slide what the report looks like. And they're going to see that you passed your biological indicator, you passed your process challenge device that you do for every cycle. On the bottom right is your resource center. And I think my next slide talks about it. This is what's in your tablet for you. So the other big thing about SterilWize is everything's in the same area. Everything is all there that you need to look up, to show someone if you have an inspection. So you have your equipment, manufacturer's instructions for use and manuals. So this is all of your sterilization equipment that you use in your sterilization area. All your manuals are there. If someone doesn't remember how to clean something, they just have to, with a push of the button, open that menu, open up that sterilizer and see, what do I do? What do I have to do for cleaning this? Or they forget how to do it. How do I do it? Sonia talked about safety data sheets. Well, safety data sheets, yes, very important. And I do agree, saving them alphabetically, easiest way to look up a product. These are saved alphabetically in your system. SterilWize sends you a master sheet. You tell them all the ones that you need to have in your tablet, and now they're all stored here. Something happens, someone gets etch in their eye while they're going to the eye wash station, which everyone should have. Someone else is going to the safety data sheets and they're looking up number 4. Number 4 is your first aid. So you want to be able to get to it easily. All of your guidelines and regulations are here. This is there, and they're always updated for what's going on. So you have your RCDSO, your CDHO, public health, along with their checklists, any pandemic regulations that are there. So it's all stored in there. And from the back end, like when the RCDSO did their January 14th new pandemic manual, that got populated into all of our users into their tablet. IPAC manual, like Sonia said, very, very important. So you have an IPAC manual, and if you don't, that is something that you need to do. That manual will be sitting in your SterilWize system. So that manual, you'll have contents. You have to look something up. You've forgotten something, or it's a new staff member that's been trained. Of course, they've read your manual, but now they need to look something up. So all they have to do is just open up this menu. The menu is going to come up. They'll go to the contents and pick what that they want information on. SterilWize has partnered with the U of T in having their instructional videos for training. So these are the animated videos from the U of T IPAC course. Kind of just gives a nice little run through. It helps with training. You're going to show this video, and then of course you're going to add anything that you do more for your office. So this is all here in your tablet. We'll talk about the web portal because all of this information you can also open up in your web portal on another computer. A little visual of what you would see for the SterilWize system. So there's an example of the start of the day tasks. When you open the tablet in the morning, right away, this is going to come up. You can't go past this. These are the things that you have to do in the morning before you start sterilization. So you're going to check these off, you're going to push save, and now it's going to take you to the next thing that you can do for sterilization. Anyone who is identified as a clinical staff member that would do reprocessing, they would have a wristband. And this wristband, what it does is it identifies them in the system. So anytime you do anything with the tablet, you just have to tap your wristband on the lower left, and then now it puts in your ID. So that now it shows Susan's the one that put these instruments into this sterilizer, but it was Sarah that took them out. So you have to always scan it so that the ID, the initials are always in there. Here's a little visual of the scanner that's in your operatory. This is for you to scan your instruments back into your patient record. And I'll go through that on a slide. So here's an example of processing a load. Looks like a lot. It is so quick. So the first step that you have to do, and this would be a sterilizer that does not need to have a Bowie-Dick test. If it did, that would be your number one. So number one is to enter your biological indicator. So it's telling you you have to do your spore test. So you put a barcode on for that spore test, scan it through. Then we know the biological indicator goes into your process challenge device. You'll have a barcode stating it's your process challenge device class 5. And then the next step, so that's just 2 steps. And the next is adding the rest of your cassettes or pouches. So right down here, 3 possibly cassettes were added to this load. So now your load is ready to go and be processed. You're just going to push next. Of course, SterilWize cannot close the door and start the cycle, but you'll say next, pick the load that you're going to use. And now that cycle is going through. You're ready to go. Everything's done until it's time to take that load out. So the next step, when your load is finished, we all know that you have to have a process challenge device for every load. That's a class 5 indicator in a process challenge device. When that load is finished, you're going to validate that this class 5 did pass. You want to have all these records showing, not just saying yes and checking off on a piece of paper that it passed. So you want to the system lets you take a picture of it. You're going to take a picture, you're going to verify that yes, it passed, and you're going to update the load. Your spore test, depending on if it's 24 minutes, 1 hour, or 24 hours, is when you're going to update your spore test. Same thing, you want to take a picture. You want to take a picture showing that it's turned purple, your barcode will be there. Same thing, you want to update your incubator. At this time, when you're updating your process challenge device, it means the load is finished. That's when the SterilWize artificial intelligence happens to mechanically verify your cycle parameters. So for smart sterilizers, it pulls up your cycle parameters so that you visually see on the right-hand side your time, temperature, and pressure. And then you have to check off that, yes, I did see the cycle parameters, because that's something you need to see after every load. And now you don't have to write on your log sheet what the time, temperature, and pressure was. Saves a lot of time. And then, of course, now we want to assign the instruments to the patient. So we were talking, Sonia was talking about a BI recall system. Number one, most important for IPAC. Well, you need to know who you use those instruments on. If that BI fails, for one thing, SterilWize is going to let you know that the BI failed. It's not going to allow you to use those instruments. So if you try and scan the instrument from checkout, you're going to scan it. Here is where the barcode comes up. If that BI failed or your process challenge device failed, it's not going to say available here. It's going to say not available. It means that you cannot use this on a patient. So it's a great little safety check that you cannot use that on a patient. Patient details are here. This is where, a list of your patients for your office. So you scan out what you want to use on the patient. Let's say you have 2 different cassettes, maybe a pouch with a handpiece. You scan them all, you select your patient, and then you just assign those instruments to that patient. Now you have a record of what you used on your patient. If public health ever came in, they were doing contact tracing. Let's say they even called you and they said, Susan was in your office last Wednesday. She's tested positive for COVID. Can you tell me what instruments you used on her? Do you have proof that all your sterilization processes, parameters, went through and they were accurate. And then of course they always ask what were your protocols for PPE? Same thing if they come into the office, you just have to scan in that barcode in your report and it'll pull up all that information for you. So it's like a touch of a button and in real time, you'll have the information for them. So these are your daily reports that you would receive. So it's great to do all this reporting, but you want to have it and you want to save it for many years. As we know from the RCDSO, everything is 10 years at least that you're saving your items. So we automatically email you your reports daily. The minute the clinical staff member does the end of the day tasks, close down the system for the day, those reports are generated and now they're emailed to your office manager or whoever you designate. So your master report is the report of everything. It shows that all your steps were done, everything passed. That's one of the reports you receive. Your load report, so it lets you know the loads for the day that your biological indicator, BOE-DIC, your PCD, all of those items passed those loads. Your cassette or pouch report, so instruments that were processed for that day, it's all in that report, sorted by instrument type. So when you're scanning your instruments through, you're scanning, you give us the list. It's like handpiece, surgical, endo kit, whatever you use in your office, and we modify the tablet for you. And then assignment report. So you get a report of what you used on every patient for that day, sorted by the time of use. An availability report. If you have a very large office, let's say you want to know how many hygiene kits do I have for the next day? It's going to show you how many you have that are available and sterile. And then alert report. So this is, you will get this report if there are any alerts. If you had a failed process challenge device, failed spore test, your BOE-DIC failed, that's in your report right away. So that's part of the recall, is always having reports of what happened. These are all on a web portal also, so you can look it up. Maybe the office manager wants to look, every day what happened in the office, or you have 2 offices and you want to see what's going on for both offices. Here's an example of if you pull something up on your tablet automatically, what you're going to see. So here's your load report for the Statum 5000, the load number, the cycle number. This is your process challenge device pass. This is your spore test pass. Susan was the one that took these out of the sterilizer, the date, and that everything has passed. And then your cassette or pouch report, this is the barcode from the cassette, the load number, cycle number, that it passed, the date and time, and that it has passed your process challenge device and your spore test, and it's available. This lets you know what's available, and then it would also have what's used. So you would know that for these 3 types of cassettes, you have them available for the next day. This is your web portal, so similar to your tablet, but it's on your computer system and has a little bit more. This lets you look up anything you want to look. So this is your dashboard telling you what you've done for the week, last week, 2 weeks ago. You have all these other items that you can open up so that you can take a look. The other thing you don't see on this screen, and maybe it's under team, but there's training. So they have training PowerPoints for your staff. So you hire a new staff member, you want to help to show them how to use the system. You can pull up the PowerPoint, do that with them first, and then do the walkthrough. So now they have a visual of how to do this. The COVID-19 module, this is a module that we included with SterilWize. So it's touchless screening for your patient. We know the admin staff, it's very overwhelming. Even though we've been doing it now for a while, it's still overwhelming, all the screening we have to do. You have to check that the patient sent it back, or did the patient say yes, and we don't know for sure. So what you can do is you send this out with the COVID-19 module. you're sending out with the email directly to your patient. They're clicking on a link. They're filling out the first section of the COVID assessment. And then you also have your patient acknowledgement form, consent form that they're filling out. If your patient said yes to any of these questions, right away you would get an alert. So the front desk would get an alert that this patient said yes. You modify what you want to say to your patient. You're telling them to call you anyway, but you're being told ahead of time that now this patient has said yes to one of the screening questions, and now you can investigate further. So the report that you get is your patient consent form comes back to you. That's the pre-screening, that's the first column. Then the in-office screening, that's what you fill out when the patient comes in, take their temperature, ask them the questions again, fill it out. And then when the report and the patient is finished, you get a report of the instruments you used on that patient. So now you know, yes, they passed the screening. Let's say public health comes in and wants to talk to you about that patient because there's something going on. You can show them the screening, the consent, and these are the instruments we used and that they all passed. This can also be integrated into your software system. So you can put it into your dental software for each patient, but it's also on your SterilWize portal. You can pull it up anytime. COVID-19 reports for your staff. You really should be asking your staff ahead of time before they come in. So you can send them an email they fill out. So here's an example of a staff member that said no the day before. And then when they came in, they said yes to one of the answers. So of course that staff member is sent home. But this gives you the report. Now you have no more pen to paper of the staff coming in, filling out information. It's all going to be on your SterilWize system. Why are offices going chartless? We want it all to be touchless. Touchless, digital, so that it's something easy to open without flipping through a bunch of pages. SterilWize as compared to other systems, so we have a lot more, as you already saw, the reports that we have, the resource center, which is very big for SterilWize, very good for you to have everything in one place, helps you with training, helps you with identifying areas where you don't know something, you want to just open it up and look it up and see. So great for your staff. It takes away all the stress from your staff of trying to write everything down, keeping your log reports on the sterile side, keeping your manual on the sterile side, cleaning their hands before they write anything down. Everything is automated through the SterilWize system. So we have basically gotten rid of any pen to paper. So why automate? Of course, to increase your quality of your reports, quality of the day for your staff, not missing a step, not having any human error. Of course, that increases your profit and revenue, time saved. Everything, like I said, is in one area. So your resources are there, your monitoring is there, and all of your documentation is in one place. You don't have 6 different areas that you want to go to for everything. So the documentation, we'll just go through it. Like I said, everything has to be saved for 10 years. So 10 years from now, you can pull up a report that's going to let you know who started and finished that sterilization process, because it's not like it's always, you know, the next week someone's asking for a report. It could be 6 months from now. It could be 6 years from now. All your digital photographic records, that's your process challenge device, class 5, your PCD, your spore test, all of that is there for you. The staff who did it, what time, temperature, and pressure, so your cycle parameters that we do have to see to be able to release a load after every cycle. Doesn't matter if you have a 24-minute spore test, you still have to see your cycle parameters after every cycle. Documentation that all the tests were passed, very important, before the instruments were used on your patient. So that gives the dentist, the manager, peace of mind that you're not going to make a mistake in your office. It's going to show right away for that staff member that you should not use these instruments, or yes, these instruments are great and they've passed everything. Effective patient tracking mechanism, like I said, that's what we talked about. Number one, the BI, tracking what instruments you used on a patient. If it's a situation where you have to go back and possibly call a patient because your BI failed and then failed again, that's when you decide if you need to contact your patient. Well, you have a tracking system. So if you had to do that, you could do that. So it increases your profit, your revenue. So staff costs, I mean, this is just an average that we got from the ODA, minimum of $25 per hour. You're saving 20 to 25 hours approximately a month. And of course, it depends on the size of the office, but that's what you're estimating that you're saving of pen to paper, documentation, looking things up, saving things, creating all your maintenance log sheets, any other log sheets. So that way, of course, you can increase your production. That person that is doing all that extra work, pen to paper, or not just one person, now they can be doing more productive things, filling holes in the appointment book, helping to fill cancellations. I mean, that's up to like $400 an hour. If it's a hygienist, they have time to work more on their patient, extra units of scaling, patient education, doing consults with your patient. You have more time for all of these little things. We now have leasing available. So lease to own, that's so that you can start right away with the system, $0 down, let SterilWize pay for itself right away to give yourself peace of mind and help your staff not to be so overwhelmed and so worried about not doing something right or missing a step and not doing it correctly. Dr. Soll, now I'm going to call you on to give us a little overview of what your staff thinks of the system, maybe touch on some of the points I made.
So the first thing that I'm going to say is that I noticed on the bottom of my screen that as the presentation waned on a little bit, I noticed probably about 4 or 5 people had dropped out of the presentation. And I thought, how sad, because as great as Sonia was bringing us the information that we need to know, seeing what SterilWize can do for your office and how it combines with what Sonia is jumping up and down. As I like to say, Sonia's ringing the bell on the Titanic. This is probably the most crucial area to running a successful practice today. And what SterilWize has created, packaged, and put a bow on it is the biggest gift. Because if you take the SterilWize system and you combine it with all of the issues that Sonia brought to light, it's just a huge gimme. It's a huge problem solver. And so I truly believe the system pays for itself. Forget about anything else, just in peace of mind. I think the system pays for itself 10 times over. So when you're asking me from a wet finger dentist, I will tell you, and I said it in the beginning, I'm a great delegator. I have a dedicated sterilization officer who runs our whole Steri Center and utilizes the SterilWize. That being said, all my assistants do help them. They all understand the program. They understand how things work. It's just total peace of mind that everything that is going into the operatories, we have the little scanners that Susan showed you in each operatory. I can tell you that if every one of my assistants and hygienists were here, they'd all be jumping up and down. Oh, it's amazing. It's just so simple, all these sorts of things. From all the dentists that are on right now, I can tell you, it's not just the salary that you pay your staff. You have to keep them engaged. And Roger Levin, probably the transitions of the United States, the Roger Levin Group. Roger always said that patients equate high high tech with high quality. When patients come in and they see how you're running your sterilization area, they see how they're just using barcodes in the operatories. Your patients are going to come away with a very secure feeling. So, Susan, to circle back, yeah, I mean, my staff just love it because it simplifies things for them. And the patients love it because they see how on top of things we are. I love it because I know that if, God forbid, a inspector walked in, we can very quickly prove to them that we are on top of things. Everything's documented, and we can show where all of the sterilization has been working.
Exactly. And everyone just wants peace of mind. You guys just want to do your dentistry. You know, you don't want to have to worry that, you know, your staff is, or you don't want to hear that your staff is overwhelmed. I mean, I've been into offices where they're just like, oh, this paperwork, or I'll give a lecture and all the assistants are like, I'm quitting dentistry. I don't want to do this, because it is a lot of work. Let's make it simple. And like you said, Dr. Soll, let's be digital. We should be digital. Everything should be digital. And of course, it's patient perception. The other thing I did forget to say is that SterilWize does have marketing for your website so that your patients will see that you're using an automated system and that there's no, it's a no fault system for you. Talks about infection control and what you're doing in your office, because that's what you want your patients to know.
Awesome.
Thank you.
Thank you very much. I think it's 8:14. I'd like to jump to questions. We have quite a few to work through. Everybody ready for some questions?
Yeah.
Sure.
We'll do our best.
I'm gonna spread them around a little bit. First one for you, Sonia. This relates to one of the first things you talked about, one of the first kind of stories that you related. Do you have to label a commercial product in a dental practice relating back to your hand sanitizer comment? Shouldn't a commercial product already have the SDS?
Yeah, so it's kind of multifaceted. It really depends on where the product's going to be located. If it's like I showed the hand sanitizer, there's multiple people using it and accessing it. It actually, if you bought it at Shoppers Drug Mart, it doesn't come with an SDS. If you bought it from your dental supplier, it comes with an SDS because there are hazardous components in it. So you have to keep in mind who's using it. If you have a cleaner and they're using bleach in the bathroom or Windex on the mirrors, and it's only the one person using it, you don't need to have an SDS for that. If it is also something where you're transferring to a different container, so you're now, cold soaks aren't recommended, but you're putting your solution into your cold soak, it's no longer in the original bottle, that has to have a label. Your cold soak container has to have a label. Or your ultrasonic, you're transferring solution into the ultrasonic, there should be a label somewhere on the lid of the ultrasonic, somewhere showing. So it really depends on what the product is and who's using it. So hopefully that clarifies.
Awesome, thank you. Susan, the next question is for you. Can you use the COVID module in SterilWize for patient consent forms?
Yes, you can. You actually can modify your consent form for exactly what you say in your office. So the consent form goes, and the screening goes, and what you write in that email, you can modify it yourself. You can say, please, Susan, when you come to the office, this is what's going to happen. We're going to take your temperature. So you could definitely can modify it to the way you want it to be for your patients and for your office.
Awesome. Thank you very much. There was I'm going to direct this one to Dr. Soll, but if anybody else has any feedback, jump in. Our team is having difficulty with heavy duty gloves during reprocessing because they cannot handle the instruments well. We've tried a few different types of gloves and nothing has worked. Do you have anything that you like to work with, Dr. Soll?
Honestly, I can't really speak to that. I know that my team does use, heavy duty gloves. I will, hopefully my office manager won't go nuts on me if she gets 97 calls tomorrow. But you're certainly welcome to, if you just contact info@centraldentalgroup.com, just say that you were on tonight's seminar, if they could, loop it back and let you know what type of gloves that we do use. But I've never heard of a complaint from our reprocessing staff that there's an issue. So you may want to check in with the gloves that we use.
And
oh, sorry, go ahead, Sonia.
I think my 2 cents is, as long as you're, doing the major cleaning, if your instruments are in a cassette, doing things like arranging the instruments in a cassette, which takes a little bit more dexterity, you could switch over to regular gloves. It's more so reaching into containers of water and that kind of thing that you want to be wearing your heavy duty gloves. And again, this is where Dr. Soll was talking about having great dental reps, like talking to your reps, saying what you need. You might have, your sterilization person has tiny hands, and so they can recommend a better product for you. I don't know products off the top of my head because there's so many. As long as they're chemical resistant and they are heavy duty for puncture resistance, that's what you need.
Yeah, exactly. And they do come in small, medium, large, and extra large. So you want to make them hand appropriate, then they're not so cumbersome.
Mm-hmm.
Awesome, thank you. Next question. Does the SterilWize system log maintenance history for the sterilizer?
Yes, it does.
Okay.
Yeah, so that's like I said, you'd put in doing your water quality test, and it's going to pop up in 3 months to go and do that. And now that you've done it, you're going to put in your past that you have, and now that's recorded. So now you will have that report of maintenance.
And is that data stored in the cloud?
Yes. So we send you your reports daily, but your reports are always encrypted in a cloud anyway. So if for some reason, your whole system crashed or something, we always have those reports for you in a cloud.
Okay.
But everything's on your tablet.
Awesome, thank you. We have a couple of HVAC questions. I'll direct it to Sonia, but anyone else can chime in who likes. Okay, so the first question, very broad, but perhaps you've got some recommendations, Sonia or Susan or Dr. Soll. Where can we get HVAC done properly?
So your HVAC technician should be providing you with your report. So if you have solicited their services, they should be directing you because it's based on the product that you're having installed, what purifier you're having installed. So they should provide it. Hopefully that helps.
Okay. I'm going to jump in, Sonia.
Mm-hmm.
Because everybody practices in different environments, your overall HVAC, you may need to find out from your landlord what's going on, and that's your starting point. But as we all know, I think that the ODA quoted that 80% of dental offices before the pandemic had open rooms where there was not sealed right to the ceiling. Hopefully people have figured ways to get around that, sealing up the rooms, whatever. But what we do in our office is, we were very lucky. When I built my office, the walls were built right up to the underlying slabs, and we had glass doors put on. And then to go the next step, we ended up buying the Jade air purification units from Surgically Clean Air. We know what the rate of of air purification was per unit. Again, you can email my office, and my office manager can tell you, we hired air purification engineers, and they came into our office. They saw the stats from the Jade units. They did a volume measurement, width, depth, and height of each room. They did a volume measurement, and then based on the Jade units, they told us how long it took for the air in that room to be totally turned over. We then created and laminated do not enter, AGM procedure going on, and then it said time finished. And this was specific to every operatory of the 6 operatories because each one's a different size. It says time finished, time to enter. And then underneath it said, say in our smallest room, 6 fallow time, 6 minutes. And then we had a little asterisk, and underneath it said, documentation available upon request. So the engineer's report with the engineer's stamp is in a binder in my office manager's office. So again, if we are assessed by the health department and they look at each plasticized card on the glass door of each operatory, it will say what the correct fallow time is for that room. And then they can go and my office manager will show them the engineer's report that did that air quality assessment for each room. That's probably about the best HVAC documentation that you're going to get.
Yeah, and that's what I was going to say too. All of that information needs to be on your HVAC report because each room can be slightly different sizes. And so it's going to affect what the end air changes per hour is. And that's what they want to see on the report.
I'm going to do 2 more questions. This one is for Sonia. Do we need to keep the Bowie Dick?
You do not need to keep the Bowie Dick, similar to the other biological indicators, as long as you're logging it. There are some offices that some of the test kits have an indicator, and even your indicator in your biological, they're keeping those as if they're doing paper charts and they're doing paper logs, and they keep the indicator. But as long as your log is complete, you don't need to keep it.
Okay, awesome. And the last question is with respect to support for SterilWize. It's kind of a 2-part question, Susan. There's a general question just about support for the unit in general. There was another question with respect to software crashes. If the unit crashes, is it a simple reboot to get it started back up again?
Okay, so first let's address support. So because we are global, it's 24-hour support. Most of the things that happen that you maybe want to change something or it's the wrong cycle number, it can all be done on the back end on real time. If something happens, the system crashing would be more your internet going down or something like that. Of course, it's usually only something for an hour, but remember, if something like that happens, don't stop your sterilization and load everything up and wait until it's done. You just have to document the load that you did, send it to SterilWize, and they can put it into your report. The system itself crashing is more like a reboot, like you said, but if your internet goes down, then yes, you have to wait for it to come up, but you don't have to stop your sterilization. Just go back to the yucky way you were doing it, of doing pen to paper.
Awesome. Okay, I just wanted to mention a couple of things before we sign off. So just remember, everybody, the code that's in front of you right now, code -SW 2021. If you reach out to the good people at SterilWize, that will give you your first 3 months free. So it's a great way to get into the SterilWize system. Also, on behalf of Transitions, we'll be sending out a letter of attendance for everybody who participated in tonight's session. Those who would like to discuss their IPAC needs, if perhaps during Sonia's top 10, you've identified a couple of areas where maybe you need to kind of beef up your IPAC. We're going to be making available a complimentary 30-minute Ask the Expert call with Sonia to anybody who wants to go over their IPAC compliance. So that'll be going out tomorrow or Thursday at the latest. I think just based on the amount of engagement, I know Dr. Soll mentioned that a few people dropped off, but not too many. So clearly this is a topic that people, given what's going on in the world, it's very topical, but everybody kind of stuck around for the full hour and a half, and that's awesome. There's great information that was shared. We're really pleased to be able to bring it to you. I want to thank our panel. Thank you, Dr. Soll.
Thank you for including me.
It's great to have you. Thank you, Susan.
You're welcome. It was lovely.
And Sonia, thanks very much. Awesome job.
Thank you, Paul.
Okay. So yeah, so look for an email from us tomorrow or Thursday. And if you want to take advantage of the SterilWize offer or take advantage of our offer for a 30-minute Ask the Expert call, we'd love to help you out. Thanks again, everybody, and have a great night. Thanks, Gavin. I almost forgot Gavin.
Oh, my pleasure. My pleasure.
You're so quiet over there, Gavin.
Thanks for letting me host, everybody. It was nice. Thanks for everyone who attended, and have a great night.
Okay. Thanks, everybody.
Thank you.
Okay. Bye-bye.
Thank you.